Welcome back to my channel. Dear friends, today we are going to learn about Mpox or monkey virus. In London, the World Health Organization declared 18th August 2024 that the increasing spread Mpox in Africa is a global health emergency, warning the virus might ultimately spill across international areas. Who said Mpox was recently identified for the first time in 4 East African countries like Burundi, Kenya, Rwanda, and Uganda. All of those outbreaks were linked to the epidemic in Congo. Tedros said there was concern for the further spread of the disease within Africa. Now we will know about what is Mpox. Mpox or monkeypox is an infectious disease caused by the monkeypox virus. Mpox is an infectious disease caused by the monkeypox virus. It can cause a painful rash, enlarged lymph nodes, and fever. Most people fully recover, but some get very sick. It can cause a painful. Symptoms of Mpox can include swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters that appears on the face and on other parts of the body like the hands, feet, chest, genitals, or anus. Anyone can get Mpox. It spreads from contact with infected person through touch, kissing, or sex animals when hunting, skinning. Anyone can get Mpox. It spreads from contact with infected person through touch, kissing, or sex animals when hunting, skinning, or cooking them materials such as contaminated sheets, clothes, or needles. Pregnant persons who may pass the virus on to their unborn baby. Common symptoms of Mpox are rash, fever, sore throat, headache, muscle aches, back pain, low energy, swelling. For some people, the first symptom of Mpox is a rash, while others may have different symptoms first. The rash begins as a flat sore which develops into a blister filled with liquid and may be itchy or painful. As the rash heals, the lesions dry up, crust over, and fall off. Who is most at risk? People who are immunosuppressed because of medical conditions or medication are at higher risk of complications from Mpox. People who are immunosuppressed because of medical conditions or medication are at higher risk of complications from Mpox. According to the US Centers for Disease Control and Prevention, those at risk also include pregnant people, children younger than 1, and people with a history of eczema. According to the US Centers for Disease Control and Prevention, those at risk also include pregnant people, children. During the 2022 outbreak, many people who initially presented symptoms were mainly, but not exclusively, men who have sex with men. Mpox management and treatment. First of all, supportive care. It includes symptoms and management. The primary approach to treating Mpox involves alleviating symptoms. This includes fever and pain. Over-the-counter medication like acetaminophen. Or ibuprofen can be used to reduce fever and relieve pain. Hydration. Patients are encouraged to stay well hydrated, especially if they have fever and losing fluid due to vomiting or diarrhea. Hydration. Patients are encouraged to stay well hydrated, especially if they have fever and losing fluid due to vomiting or diarrhea. Skin care. Keeping the skin clean and dry is topical treatment. May be help to soothe and protect skin lesions. Easy relief. Antihistamines or calamines lotion can be used to reduce itching. Number 2. Isolation and infection control. This includes isolation. Isolation is infected individuals should be isolated to prevent the spread of the virus, particularly until all lesions crusted over, fallen off and new skin is formed. Infection control. Proper hygiene including hand washing and use of personal protective equipment is by caregivers are essential to prevent transmission. Infection control. It includes proper hygiene including hand washing and use of personal protective equipment. Antiviral treatment. Tecovirimat is an antiviral medication approved for the treatment of smallpox. Cidofovir and brimcidofovir are their antiviral drugs that have shown some efficacy against orthodox viruses in the lab studies. Manila. According to Manila, August 1900 Reuters, the Philippines has detected a new case of the Mpox virus in the country, the first since December last year, its health department said on Monday, adding it was awaiting test results before being able to determine the strain.